Brain is made up of complex tissue and it has got electrical activity. It is normal, but when this electrical activity discharges abnormally, then it causes convulsion or seizure, and this is called epilepsy. In fact, there are different types of epilepsy. It may be generalized tonic-clonic epilepsy, it may be complex partial epilepsy, it may be absence seizure. So, for the treatment purpose, we need to differentiate what type of epilepsy and what anti-epileptic drugs act on this disorder. It's not a rare disorder. It's present from the ancient time. 3000 years back, it is written the signs and symptoms of the epilepsy. And nowadays, it is present 50 billions of people worldwide. No, it is not a mental illness. Basically, don't understand why people call mental illness. Mental illness does not come from the ear. It is not from the ear. It is basically a neurological disorder. And epilepsy itself is a neurological disorder. And it's a periodical effect. Sometimes it comes as a generalized tonic-clonic spasm of the limbs and patient become unconscious, and sometimes and periodical behavior disorder may present with seizure disorder. But you can't speak it's a mental disorder. It is something from ear or some curse of the god like this. It can be cured. In fact, those who got anti-epileptic drug, 70 to 80% become the seizure free, and more than 80% with the medicine, if they take 2 to 5 years, they will be cured, and rest 10 to 20% of the patient needs further treatment for relapses. No, not at all. You know that Napoleon Bonaparte, Leonardo da Vinci, or Leander Page, they have seizure disorder. They took anti-epileptic drug. They are best in their position, so it does not affect intelligence. In fact, some of the mental retarded patients have epilepsy simultaneously. That does not mean epilepsy causes mental retardation. No, it is not a communicable disease. It does not spread with touching or coughing. It is not an infectious disease at all. So you can live with epileptic patient very much. There is no problem. Oh no, it is not a curse of God. It is an illness like other illness. So don't blame him. In fact, patient has become suddenly unconscious and there is a jerky movement of the limbs, heads and muscles of the face, and they regain consciousness within 5 to 10 minutes. If they are in status epilepticus, this convulsion repeatedly again repeated. And sometimes epilepsy may present with short span of behavior disorder, which is periodically present in that patient. And sometimes patient may not be unconscious fully, and in partial seizure, there may be part of the whole body, that may be the right hand. There is a jerky movement, and that may be a complex partial seizure. First of all, in the rural area, may not be rural, sometimes in the urban area also, some people believe that marriage cures epilepsy. It is absolutely wrong. Absolutely wrong. Marriage cannot cure any disorder, any disease of human beings. And what about marriage? Yes, an epileptic patient can marry. I do agree with the other scientists also. Yes, they can marry. In fact, if a male patient have epilepsy, there is no problem with marital life. If it is a female, one question arises whether they can get pregnant or not. But the thing is that if there is a need to continue the anti-epileptic drugs, I must say that if a female patient not taking any drug at all have got 3% congenital abnormality. If a female patient with anti-epileptic drug, they are taking anti-epileptic drug, their baby chances of their baby congenitally abnormal is 5 to 6%. So it is only difference between 3 to 4%. So you should not be worried about the children. So anti-epileptic medicine cannot be a barrier of marriage. In fact, if you got epileptic disorder or epilepsy, in that case, you should be cautious regarding two things. First, one is you have to take medicine regularly. I used to tell my patient, if you don't have rice, but you should have medicine, because you don't miss the medicine, not a single dose. Number one. Number two, night waking is a very, very bad for epileptic patients. So sleep is very important for epileptic patient. And other things is driving should not be allowed, swimming should not be allowed. You should have an identity card in your pocket always, and if you are a student, your institution should know that you have got epilepsy, and your guardians, if you are a parent of a son or daughter of epileptic, then you must aware and you should inform a school and teachers that your son or daughter is a patient of epilepsy. You should be extra cautious regarding this. Otherwise, no problem. Epilepsy is not a very fearable disorder, I think. Basically, during attack, if you see an epileptic patient, so first of all, you should ensure three things. One is passage of air, his respiration is okay. Number two, avoid any injury prone things, whether he gets injured or not. You just look after this. And otherwise, there is the people around him is sometimes become very problematic for the patient, and you just remove them by the side of him and give him air. The thing is that during attack, some people suggest to introduce spoon or cloth inside the mouth. It is not recommended, and you should not do it. Otherwise, it will be really harmful not only to the patient but also who introduces his finger to his mouth. And number three, after the regaining of the consciousness, you should bring him to a doctor, nearest physician, for his first aid and treatment, and then he should be referred to a neurologist or psychiatrist or whatever it may be. It is not a communicable disease. It is not a curse of God. It is a disease like fever, which generally common to all of us. So don't be scared. Be smile. Be with the epileptic patient and fight against epilepsy and support epileptic patients. Thank you.